Hey, DNA. I'm Kate Wilson, and you're listening to All Access DNA. Thank you to everyone who reached out to me about our last episode on longevity. It sounds like it sparked some really interesting conversations. This week, we are sharing a parent advocacy story and how a mom built a community. Meet Madeline Cheney, who has two kiddos, Wendy and Kimball. While pregnant, Madeline learned that Kimball had a rare syndrome, and in fact, is one of 125 individuals in the world with this condition. Eventually, she founded The Rare Life, a nonprofit and podcast community for parents of people with medical complexities and disabilities. We talked to Madeline about her experiences, including a discussion about carrier testing for both her and her daughter, as well as the importance of connection and realizing that you aren't alone. Let's get started. Well, thank you, Madeline, so much for being on the show today.
Yeah, it's my pleasure. I'm happy to be here.
I'm excited to have you. It's always nice to have somebody else who works in podcasting. And you have a podcast, and it's called The Rare Life. So I was hoping you could tell us some more about it.
Yeah, so it kind of was born from a place of desperation for something like it when I was navigating my own journey with my now 7-year-old who was born with a rare condition. I found it intensely isolating. And we can get into more details later, but long story short, I was like, where are my people? Where is this community? Like, I need to find people who understand because suddenly my mom and my sisters and all my friends, like, no one understood what I was going through. And so, when I kind of poked around for community, I mostly found, on social media and places like that, a lot of really, really optimistic views of, having a child with a disability. And I feel like there's a time and place for, everything. But I was like, where I need to create a community where we feel really safe and really honest. And so I think, there are some really heavy, dark aspects of living this life. And I feel like it's super important to be able to talk about that and to know that, you're not the only one having these thoughts and these feelings. And so that's kind of where the Rare Life was born as a place to create that community. And so, it's been almost 6 years now, and it really has. I think a lot of people are pulled toward it that are more open to that honest conversation about the hard stuff, and so it's really created a community of people who understand and like that kind of honesty. And I know it's not for everyone, but it's been really it's just been such an honor to see the way that it is able to uplift people who are navigating such a complicated situation.
And it sounds like it's much more than a podcast. It's a community, and it's a resource, and it's a support, like you said, for folks who are in this area and probably want something more that feels uh, authentic, that looks at both the easy and the hard, like you said, that doesn't necessarily sanitize what folks
Yeah.
are going through.
Yeah, for sure. Yeah. And that is something that has been really cool with this is that I think a podcast can be a really great platform and tool for scaling. Actually, I didn't come up with this. Someone when I was first conceptualizing everything, there was this podcaster that shared how to start one. And so I was doing all the research because I knew nothing about, this world. And he talked about how it was the best way to scale intimacy. And so that really struck me. And so I think that's why it can be such a powerful tool for building a community, because you can feel like it's just you and the guest and the host. And especially with these types of topics, I think that's super important. And so it does lend itself to a community. And then it's kind of by extension, we have a very active community on Instagram too. And so that's kind of the way that we're able to interact with the community members. Cause at first it was really, it just feels really one sided when you send these out into the world and you're like, people are listening. So I assume, they're there. But being
Right.
able to interact online has been a really awesome other side of this too.
Right. And we'll put a link to the Instagram and website in the show notes, because really it's more, like we said, more than a podcast. There's also a nonprofit, and you talked about your son and his diagnosis and kind of the inspirations. So tell us a bit more about your son and your family.
Yeah. So my husband and my two children and I, we live in Utah near Salt Lake City. We're transplants here. And um, Yeah, my daughter is almost 10, and then my son Kimball is 7, and he has the rare genetic diagnosis, and, trying to think, we like to go outside together. I feel like life feels pretty typical for us now. We've I think a lot of that is adjusting to, having a child with disabilities, and, um, so a lot of it is that too, like, going to all the appointments and things like that feel so normal, and, the IEP and everything is just part of our world now, but also because he has stabilized a lot health-wise, which we find ourselves very fortunate. That's not super common, I think, in this community. A lot of kids stay just as medically complex or even, progress, in their diagnoses, and so we're very, very happy with life. We feel very grateful that he's so stable. So,
And he was diagnosed, you said he's 7 now, and he was
mhm.
diagnosed, I guess, around the time of birth or shortly after?
Well, we had an unofficial diagnosis actually when he was about 24 weeks, gestation. So, before he was born, and that diagnosis turned out to be accurate. So, there were a few markers that our MFM was able to see on ultrasound. I mean, it's a very rare genetic diagnosis. There are 125 other cases in the world, so, that are known. And so, we're also very fortunate that she was knowledgeable enough to know about that and to see the specific unique markers, and to, set us up for success in that way, because we were able to have the right specialists and everyone ready to go, and the NICU was ready for him, and so it was a very, I mean, it was a intense birth experience, but it wasn't an unexpected intense birth experience, like has been for a lot of people in the community that had no idea that, there was anything wrong with their child before birth.
Mhm. And, one of the things that I understand is that so you're adjusting to a newborn, and kind of going through these different medical appointments, trying to find out what you can about a condition that I think you said only 125 folks in the world have. You at 9 months, or when your son was 9 months, you found out that you were also a carrier for this condition, so it's something that a parent has to be or is typically a carrier for. What was that moment like having learned about your son, going through things with your son, and now finding this out?
Yeah, I mean, it was so crushing. We were receiving, it was just such a tumultuous time. We were receiving so many, sub-diagnoses as part of his overall diagnosis. There was, some stuff known about it, but there really wasn't very much. So there were things like finding out that he was blind that, we didn't know that was even on the table. And so it just felt like there were a lot of like surprises, diagnosis-wise. And so it was just a lot of like pivoting and trying to adjust, and then another thing, and then pivoting and trying to adjust. Lots of therapy, a lot of, hospitalizations for things like if he got a cold, he had airway issues, so we'd have to go in and have him hospitalized to help him breathe. So, just a lot going on, as well as our daughter at the time was, 3 years old, and she just had a really hard time with everything going on. So she was really struggling. So all of this
I
stuff
was
was
gonna ask,
happening.
how was she doing with all of
Oh,
the
she hated him.
uncertainty and kind of all the stuff going on?
She wanted her place back as, like, the number
Yeah.
1, star of the show, and she just hated him. I mean, it was really, she would hit him and try to attack him, and it was quite, it was very hard. So, all of that to say, when we went in and I found out, there was some kind of mix-up where we were supposed to find out the test results before we went in, where they were gonna tell us over the phone, I guess. So, when we went into the appointment to discuss the results with the genetic counselor, and the geneticist, he was like, "Okay, so as you know, you're a carrier." And I was like, "I did not know that." And so it's kind of this like nonchalant thing. And it really, for some reason, so with his diagnosis, it's like 50-50 chance of whether it's de novo or whether it was inherited by the mother, because it's an X-linked condition.
Okay.
And so for some reason in my head, I knew that there was the possibility, but I was like, there's no way. Like, things have been so hard. Like, we were the, 1 in a million to have a child with this. How could that possibly be true for like that we're also carriers? And there also was some indicators that I wouldn't be a carrier. Just, I have 7 brothers and sisters. None of them had any symptoms. There just was no disability in my family. And so there were all these things that the geneticist was like, it's not very likely, but we'll test. So to find out that I was a huge, I was just very blindsided by it. And it felt like suddenly I knew like why my son, like the reason my son had been suffering so much, that my daughter was suffering, my husband and I were suffering so much. And I was like, oh, it's because of me. Like I'm the reason for all the suffering. And so that was just such a crushing thing to learn. And I've done a lot of processing of that, including recording an episode about it and hearing other people talk about how, like, I actually have felt the exact same way, that it was my fault. My body
Right.
broke my son's body. And so that helped me process. But at the time, it took a long time to get to the point of not blaming myself for it. And so it really affected my relationship with my son because suddenly all the past suffering that he'd been through, I was like, oh, it was me. And then
Uh,
everything that happened since then, I was like, oh, it's my body. And then sometimes I still find myself, kind of subconsciously like it's feeling this guilt of like, oh, I did this to him. And of course, he has no clue. And he's like, I don't know, he's just happy to be here. But,
right.
and then
Well,
it
and
also, oh, go ahead.
no, I was just gonna say, you feel responsible, and I think that's normal as a mom to want to protect your kids, right? Keep something from
Yeah.
happening, but it's this push-pull of the head and the heart. Like, your head probably knows, "I can't control what genetics I pass down,"
Hmm.
but your heart's like you said, it still comes back up.
Hmm.
Even though you've had time to think about it and dwell on it, it's still gonna come back up where there are those moments.
Yeah, yeah. I even had people telling me when I released that episode of like, I actually titled the episode "It's All My Fault" because that's exactly what the theme was. And I had this person who
Mhm.
was like, "It's not your fault. Like, like you didn't do anything. You didn't know." And I was like, "That's cute." But people who are carriers, like, I won't say everyone feels that way, but they're the people who understand. Like, yeah, but it still feels like it. Like I know logically that I didn't choose this for him. I would never would, but that just the knowledge that my body was the reason for this was really hard. And then it also affected too my view of my marriage with my husband, where I was like, oh my gosh, if he had married some other woman, then he would not be dealing with this. So that was, I mean, he's always been super sweet about that and like, oh no, I'm so glad I married you and stuff. But like, it still is a very difficult thing that our family has dealt with because of my genetics and my body. So that, that also came up. And then for my daughter, um, it suddenly was a question of like, okay, she has a 50-50 chance of also being a carrier. And of course, that would have happened long before we even thought of Kimball. And so like, as far as, like, whether she was a carrier because she was born before him. And so then it was suddenly like, okay, so I caused my son suffering, and there's a chance that I also am setting my daughter up for having this same, type of scenario that I've been dealing with, which has been such hell, and I don't want her to suffer in the same situation that I am. And so, that was also a huge aspect of this as not wanting to protect my son, but also wanting to protect my daughter and not
Right.
having any say over that. Um, which I guess just a really quick little side journey. As far as my daughter, we actually just I told her. So I've always been I'm a very big fan of like being honest and being open. Hence the podcast and stuff. But so with our daughter, we also were like, hey, like we found out that and we had like a 3-year-old version of telling her this of like I passed on his blue eyes, I passed on his blonde hair, and I also passed on this like the syndrome that he has, and you could too. And so she was like, okay, well, she didn't.
Mhm.
She was a 3-year-old,
She's
but
3.
as she's grown, kind of she's watched us and watched him, and I think that really has sunk in. And so she started talking about how she wanted to find out if she was a carrier too. And,
Okay.
that's kind of this controversial topic in genetics where it's like, do you wait till they're 18 and they're an adult and they're able to handle that kind of information? Or do you um, allow them to test younger. At this point, I mean, hindsight's 2020. I wish I would have never told her. I mean, I was dealing with a lot and
Hmm.
I don't think I was like making, I don't think that was the best decision to tell her when she was 3 that there was the possibility of her being a carrier. Because in hindsight, I wish I could have taken that worry from her. And then, we could have talked about it when she was old enough to like really deal with it. But because we'd already told her, she was so anxious about it. And so we did end up allowing her to be tested to kind of like put that at ease. and she tested negative. So she's not a carrier.
Okay.
So that was just such a huge weight off of her, off of us to know, okay, this is not going to be passed on and it won't be something that's, repeated in her story as well in the way it was for us. So,
That's a lot. I think I think it's a normal thing to sometimes with the first child, especially you're not sure what to say. I know
mhm.
there's many things in parenting, but especially this, there's no handbook in terms of, "Hey, you found out you're a carrier for a condition. What do you tell your child who might also be one?"
Yeah.
And so you're kind of trying to figure it out, and like you said, you're an honest and upfront person, so that is sort of the default. Was your daughter pushing you and your husband to get tested, or was it just something she would kind of bring up and chat about, and you could just tell how she was talking about it that she was anxious? How did it come to, like, "No, we need to go find somebody that will support us in having this test"?
I mean, probably kind of both. I mean, I think from when she was like 6 or 7, I started saying like, "You can be tested if you want to be." And at first she was like, "I wanna be tested. I'd love to have a kid like Kimball." And I was like, "Okay, like, clearly there's not like this." It was really cute, but there
Yeah,
was not like the understanding there. And so as she aged and stuff, it kind of would just come up naturally. And I don't know that she was spending tons of time feeling super anxious about it, but you could tell that, like, when she did think about it, she was feeling pretty worried.
yeah,
As part of this, also, I've had recurrent miscarriages. And so it's kind of been like a secondary form of infertility. So we wanted to have 2 more children and we haven't been able to, and we're not going to. And so I think that also the miscarriage aspect of it has really been at the forefront of her mind because she's also watched me dealing with those. And so that also kind of has brought up the carrier status question. And so as she was getting older, and she really is a very old soul. She's a very deep thinker. And so I think the idea of waiting until she was an adult was just like she was like, I don't want to wait. I want to know. So
right.
I know if I should prepare. And it was I don't know. I also felt like she was ready to do that because she also was talking about it in a really mature way as far as like I want to know so I can prepare myself and I'll deal with it and I'll handle it and I'll find out what I need to find out. And if I'm negative, then I'll be able to relax and I won't need to think about it anymore. And I was like, that's a very level-headed way to see it. And she was like, "If I am, like, we'll be fine. I'll have you and you'll help me and you'll support me and I know what it's like." And so that was something she said she wanted to test when she was 9. And she said that when she was about 8. So that year we kind of like once she was getting closer to her 9th birthday, I was like, "Okay, Wendy, do you still want to?" And she's like, "Yep, I'm ready. I want to know." And so during the time when she did test and then waiting for those results, her anxiety really ramped up. Like, she was
Yeah,
so anxious about it, and so that during that time, I was like, "Ugh, why did I tell her about this at the beginning?" I didn't regret letting her test herself because, again, that anxiety was there. Like, there was no unknowing the fact that she could be, and
right.
I do think that knowledge is power and having the, like, wondering is only anxiety inducing, and so but when she did find that out, it was just such a relief for her, and she'll still bring it up pretty often. I mean, it's been about a year, and she'll be like, "Oh, I'm not a carrier." And so that's kind of something we'll bring up sometimes, and we have to be sensitive about it too when we're talking
Yeah,
about it with Kimball in the room because she was like, "Kimball, I won't have kids with issues like you." And I was like, maybe
yeah.
'cause that's true, but, like, we we do need to be a
But
little
also there's
sensitive
another
about
way we
it."
could maybe
Ye
talk about it or
Yeah,
state
yeah,
things.
yeah. So
And
there's kind
it's
of this duality there, but
yeah, and it's interesting, though, you mentioned kind of like her psychological state and kind of what she's considering. As someone who practiced clinically, 18 isn't a magic number in terms of, "Oh, somebody is now prepared to handle genetic testing."
Mhm.
So it really is, I think, a case by case, and it sounded like she had a pretty good grasp on it. I mean, even compared to some legal adults I have seen in clinical practice. And you obviously she's your child, so you know her well. Was it hard finding a provider that could help facilitate the testing? Or did they also kind of get this sense, from you and your daughter that like, okay, they've had this conversation, she knows in her understanding, like what is going on?
I mean, I, kind of expected it to be a little bit of a I don't wanna say battle, but I was getting my advocacy pants on. Like, I was like, "Okay, this is gonna take some, like,
Yeah.
convincing and stuff." But because they had they told me when they were first telling us the results of my test of the fact that, like, we don't we don't recommend them finding out before they're 18. And so I knew that that was kind of the stance. And after doing some research and asking around, even just around the rare life community of other, carriers that have had their children tested before 18. And so I was like, okay, I know that this is like kind of a controversial topic. And so anyway, I was gearing up to advocate the case and, express how she was ready and how there was a lot of anxiety going into it. I even have there's this nonprofit, Remember the Girls. That's a great nonprofit that supports X-linked female carriers, and so I even reached out to the leader of that one, and I was like, okay, I'm like looking at doing this because she was tested when she was about Wendy's age for a terminal uh, genetic diagnosis that her dad passed away from, and so that I was like, okay, she has some experience with this. And she was like, absolutely the best decision ever for me to know about this and to have been able to talk it through, in my youth and with my parents and stuff, or with my mom, because at that point her dad had passed away. So that with her support too, I felt like, okay, I'm armed with that. And then I emailed our geneticist and I was like, hey, I know it's not super encouraged and it's not like the norm, but I really feel like my daughter would benefit from knowing this. She really wants to. We've talked to her. She really understands it. And we would really like to get the ball rolling on this. And they're like, okay, sounds great. We'll send the kit to your house. And I was like, okay, well,
Mhm.
that was, so I really appreciated that they were able to look at that and be like, hey, this is a parent that, um, I'm trying to think of how to phrase this. Not to like minimize the expertise of geneticists and genetic counselors, but to recognize the unique expertise of a parent and just the fact that like
Right,
we're the ones living it.
right.
I've experienced what it's like to be a carrier, and then we know our daughter so well. Like all of those factors and the syndrome itself, I felt like they really took my own expertise seriously, and so they were willing to be like, okay, like I can see that she's thought this through. This is not just like I just want to get my daughter tested to be so fun. Like she's really thought about this,
Right.
and we trust her gut and her thought process on this, and so we're willing to do that. So I really appreciated that.
Mhm. Tell me a bit more about your advocacy pants, because I will say I feel like this is something, in talking with other families, like you said, have medically complex children, or even adults with conditions, that there's this sort of push-pull between you as the patient or you as the parent, you as the family member, and a medical care team, for example, where sometimes things kind of gel and there's support on both sides, but there's also times where you do have to put your advocacy armor on and know I'm gearing up and I'm gonna have to have a fight on behalf of my son. What has that been like over these last 7 years?
I think it's become a lot more natural for me as I've gotten more experience in it. I think at first we had all these therapists, or at least all of these specialists that were in on the team, before he was even born. And at that point, I was like, tell me what to do. I have no idea. Like, I have zero medical background. I've always been healthy as a horse. Like, my whole family has. We've never done hospitalizations other than just having babies. And so at that point, I was happy to have them kind of take the helm. And then I think as time went on, our experience in the NICU, there were just a few things where I was like, oh, like these are humans that have a lot of training. Like they know a lot, but these are also humans.
Right,
And then a few things that happened where I was like, okay, and also they're humans that, like, most of them, I mean not all of them, right? There are definitely people who go into this practice because of their experiences of their own of having a medically complex child, but for the most part, they don't have that side of the experience. And so there were a few things, like just things that, were more of social interactions, not social, like bedside manner, things like that, where like the way they talk about things and like, oh yeah, you've never experienced this. Like you don't totally get what this is like on my side of it. That both of those things I think helped me. And then as I was gaining experience with it, I think all those things were like, okay, I can see that I have a very important role in this as the parent, as someone who knows Kimball super well, especially with a really rare diagnosis where, there's a couple papers and they're very sparse. And so like that's what they're working off of. Like, there's one other child in our state just that was recently born with this syndrome. So, that our providers have not interacted with any children with this particular diagnosis. And so really on his diagnosis, I'm an expert because I'm doing all the research and I'm finding the parents and, finding out about different like the blindness that's not part of the research. And
mhm.
then just my experience living with Kimball. And so all of these things came together to help me recognize my role in that team. And I wouldn't say that I've needed to have super confrontational conversations with medical providers or therapists. It's more of like just maybe pushing back on things that I'm like, oh, that feels a little off. Or, for one example, Kimball is probably going to have this surgery for his hearing. He's hard of hearing, and he probably will become profoundly deaf at some point. And so there's this surgery that can help improve hearing for a little while that his ENT is really on board, really wants to do. And so I think even in that situation, when we're talking through with him, I'm asking him questions about the surgery itself. But then when it comes to the recovery of it and trying to decide if it's worth it, I'm not asking him. Like I'm like, hey, can you connect me with other parents who have had their child do the surgery by, give them my information so there's no HIPAA
Mhm.
violation. But I'm not even going to bother asking you because you tell me it's a really low risk surgery. The recovery is great. It's not a big deal. But I'm like, I've been burned by that before
Right.
when the surgeons tell us that. And then we go and do the surgery, and it's like, well, maybe compared to like a brain surgery, but surgery is surgery, and my baby's in tons of pain, and I'm trying to figure out this like surgery site. So I think I've just learned that like to let the providers be the experts in the fields that they are experts on, and then to go to parents when I need experts on like the lived experience and what it's like to have a child recovering from a surgery. Um, as an example. And so just kind of letting them be the experts in their field and then knowing where to turn for experts in other aspects of it and being willing to
Right.
talk about it.
Right, right. Well, and parent experts, right, who have lived through it, who have gone through some of these things because the surgeons are not necessarily the ones that are doing the day-to-day recovery, and at
Mhm.
home. And how has having, like, the Rare Life podcast, because I think you said it's 6 years now, um, how how has that helped sort of you navigate some of these day-to-day challenges or these even bigger ones when you're thinking about types of like therapy or surgery? How does the podcast maybe help you process some of this or find support for some of these things?
I think it's really highlighted for me, and I think for hopefully for a lot of the listeners, that there's not a situation or an emotion or a feeling that a parent deals with that hasn't been felt or dealt with by another parent. Like all of these things come up. And and so I think just knowing that, it feels very reassuring, and even things like, "Okay, I need to go, like, get my daughter her genetics test, and maybe they'll push back." Just the knowledge of, like, all the countless stories that we've highlighted from different parents of, like, okay, and a lot more intense, versions of this where it's like a life-threatening situation where they had to advocate and the providers were pushing back and they found a different provider, hearing all of those stories and then seeing how impactful that is and how important it is for parents to do that, I think is just something in the back of my mind when I'm caring for my son, where I'm like, this has been done before and I can do it too. And if I'm feeling frustrated by it, lots of parents are also feeling that. If I'm feeling this huge wave of grief about like, oh my gosh, my son has to go through all these surgeries. Here's another one. I know that there are lots of other parents that also feel that extra wave of grief with surgeries. And so I think just that community and the companionship of it feels so reassuring, and it's very empowering to be like, I'm
Mhm.
not the only one going through
Definitely.
this and other parents are. And um I don't need to be perfect at it, but yeah, I think just the feeling of that presence is really, really important.
Mhm, mhm. And you had mentioned, using this community for a variety of things, but talking to him about, maybe at times of grief. So I think you did an episode about, or maybe it was something I read, it was about grieving the life that you thought you'd have, which is something I've heard some other parents that I've worked with mention, but it is one of those ones where I do feel it's, not always in sanitized versions.
Mhm.
So tell me a bit more about sort of this grief. How has that changed over time?
Yeah, I mean, that grief of the life you expect, I think, is so big and encompassing when you first find out that that's not gonna be the life that you have, right? It's usually, when you first find out a diagnosis or when they're first showing symptoms of something. And I think that that's really hard to get beyond. A lot of parents, I think, can get stuck there, and especially for parents who have children who have a terminal diagnosis or like a really just, something, a diagnosis that causes a lot of suffering. and pain, I think that that can be really hard to move past. Like, this was not going to be my life. I never wanted a life like this. I didn't want this for my child. But I do think that it helps to like, I think hearing other families talk about that pain can help you move through it. I don't I that was when inspiration of the podcast too is that I was able to receive trauma therapy at the beginning of it, right before I started the podcast, and that was so life-changing, and a lot of that was digging into the hurt and the pain, and so I think being able to see the power of talking about that grief really, immobilized me in like, "Okay, we need to be talking about this," and to help that be, like, kind of a therapeutic aspect of it. Um, and so now for me, at least, being able to process it so much, I it's hard to even imagine my life without having a child with disabilities. Um, I do find myself with things like the surgery that I talked about for his ears, things like that will kind of bring it up to the forefront of like, this doesn't get easier. Like, this is so hard to look at him and be like, oh, the incision will be this big and they'll cut into him and it might not even work. And then he's not allowed to like run around for a while. And it just feels very unfair. And like, I
Yeah.
don't want this for him, but also picturing a different version of Kimball, at least for me, I don't can't speak for all parents because this isn't necessarily how they all feel. But picturing a different version of Kimball feels like not picturing Kimball because
Right.
all of his various disabilities and even all the medical stuff he went through at the beginning, like, they've just shaped him into this adorable little boy that I love. And so there's never this and even at the beginning, there was never this feeling of grieving a life without Kimball. It was grieving a life without the struggle and the pain that he was going through and that we were going through. So it was kind of like picturing this alternate reality of like Kimball being born without any issues and being able to see
Mm,
me and being able to hear me and all those things. It never was longing for a world without Kimball. And I think
right.
that is something that a lot of parents fear when talking about this kind of thing is that someone would misconstrue what they're saying or feeling to mean that they regret their child. And of course, that's never true. But I think in the darkest moments, it's easy to be like, I wish my life was not like this. I didn't want my life to be like this. This is so hard. And it's so hard for my child. And I wish that they had it easier, like any
Mhm.
parent would wish.
Right, right. And I mean, I think that that's another key element of having this community because those types of thoughts can make you feel isolated, can also bring some type of you talked about, like, parent guilt, mom guilt, but also a little bit of, like, that shame, right? To not being able to talk about it. Have other parents that you've interacted with, like, kind of in this rare disease world or with medically complex kids, have they talked about how isolating it feels and what they found most helpful about this community that you've built?
Yeah, for sure. I mean, that's the main thing that we hear from people who message us as like a thank you for making this podcast. It is usually based around that of like, I felt so alone and now I finally know I'm not alone. And
Mhm.
so, of course, that's super motivating to continue the work. And I mean, there's this one listener too that when she messaged me, she said she literally fell to her knees when she was started listening to the first episode because and just was bawling. She was like, I found someone who understands what I'm dealing with and then they're talking about it. And so I think that goes to show too. I mean, when you're dealing with stuff like this, you're just in such survival mode, especially at the beginning when you're first figuring it all out in the first couple years. And I think the mental health is usually, I mean, I probably can say always. Your mental health always takes a hit. It's just so much. It's a lot to deal with, both, intellectually as far as trying to figure out very high levels of care, medical care for your children, and just keeping them alive and taking them to appointments, but then also the emotional aspect of watching your child suffer and having to shoulder that. And so I think, any kind of reprieve and healing or community that you can find just feels so needed, so vital, like a breath of air when you're drowning.
Mhm. I was gonna say, so how when you're in this type of state, how do you yourself keep going or putting one foot in front of the other? Like, I'm just imagining you're talking about, finding out about Kimball, working on that, finding out you were a carrier, then finding out that your daughter could potentially be a carrier. And it is sort of like the waves just keep hitting. How do you get out of that area where the waves are breaking, or how do you keep standing in that area without falling over?
Mm, I don't know. I feel like it'd be great if there was, like, one golden answer to that, but I think I just got used to that feeling, which
Hmm.
is kind of morbid, but, like, you kind of do. You just kinda get used to feeling really sad and really, like, worn out and but also, like, the feeling of, like, getting back up after you've been knocked over, and I think not being so shocked when you have your low points, I think that really helped me to be like, "This is like, I've done this before, and life went on. Like, I've been this sad before, this shocked before, overwhelmed before, and then there were days that got better after that, and so I think holding on to the hope that it usually feels really, really, really bad at first, and that it will
Mhm.
ease up as you get used to the idea, as you process it, as you find resources and support. I think that can feel really reassuring, but I also acknowledge too that because Kimball's health stabilized and he no longer is in this I don't even count him as medically complex anymore. He definitely was as a baby and as a toddler, but he's really, stabilized health-wise. So I sometimes I wonder what my life would be like if that didn't happen, if he continued
Right.
to be as medically complex and need as much support as he used to. And I don't know. I look at these other parents that have really stood up and, like, created such a resilience and have embraced their life in
Mhm.
that lifestyle, and I am just in awe because I don't know that I would have. I don't know. I mean, I don't know. I'd like to think I could have, but I think that the strength that these parents find to not just survive, but then also to, like, learn how to live their life like that long term in a way that has joy too is just it's so awe-inspiring.
Mhm.
And so I fully acknowledge too that a lot of the adjusting that I've been able to do has been because things have gotten easier medically for him.
Mm. Mhm. I think what you said was really helpful about in those early days, kind of trying to kind of just get through it. There's not sometimes there's not really a choice, right? You're just going you've got to go through it. But how some things will change over time. Is there other advice or things that you would tell a new parent or somebody maybe that's coming to the Rare Life community and is just getting into this space, like other things that you would want them to know?
I think it would I mean, I guess it's kind of similar, but it would be that like that you will become stronger. And I think it feels at the beginning like you're being beat to a bloody pulp and you kind of are, right? Unless you've been through something like this before. It's so much new I mean, I'd never been in that much pain before emotionally, watching him suffer and struggle and wondering if he would survive or not. Watching my daughters suffer and struggle with it. It was just such a new level of pain. And so, of course, I was buckling under that because it was something I'd never experienced and it was at such a larger degree. And so I think understanding that you are, even though you feel super weak while that's happening, you are building resilience while that's happening too. And I think that can feel super annoying for someone to say that while you're going through it, so I'll acknowledge that, but, I don't know, I guess it's like anything, like, if you're at the gym and you're lifting some really heavy weights that are, like, basically I mean, the weights that we lift, I mean, they feel like they're completely out of our, capability, but somehow we figure out how to lift those. Of course, you feel so weak while you're lifting them because they're so far out of your range, but in reality, you're actually building muscle while you are, doing your best at trying to lift this thing that just feels way too heavy. And so I think acknowledging the fact that you're building that muscle and you are getting stronger even though you feel so, so weak. I think that I would want parents to understand that and that they are stronger than they think they are. That's one thing my older sister told me as I was going through this of like, you're so much stronger than you think you are, and you're just finding out how strong you are. And that did feel really
Mhm.
empowering of like, oh, she's
Yeah.
right. Like, look at this. Like, I got up another day and I'm doing it. And I think that's another thing is that doing the bare minimum and like keeping yourself, well, I kinda cringe when people use that when they say, "Just keep your baby alive, that's the bare minimum for, like, postpartum." I'm like, "Yeah, well, actually, that's a lot of work for some of us because, like, physically,
Yes.
literally, it's hard to keep your child alive." But just doing the bare minimum as clumsily or as messily as you need to or, if that's your best, that is a huge win because this is so hard. So I would want them to feel proud.
Yeah. Yeah, definitely. And I think that's true about the folks that you had mentioned too that, have kids that have medically complex kiddos that continue to need major medical interventions is they're building up that resilience muscle. They've probably learned some ways along the time to kind of, know when they're strong, know when they need rest, but it still is something I think you said it perfectly, to be proud of is honestly just putting one foot in front of the other and making it through each day, because you don't
Mhm.
know what's gonna happen. Even if the condition itself is well known and well described, it doesn't necessarily mean that's exactly what's gonna be
Yeah.
happening with your kid.
Yeah.
What
And
are
I oh, sorry,
Oh, go
one
ahead.
thing I would wanna add on to that too is just to know that you're building your new normal, because I think that's what a
Mm,
lot of us talk about, like, "Oh, this is my new normal. This feels so normal to me." Like, the hearing aids and everything just feels so everyday, and I think also understanding that, like, you are building a new normal. Right now, it's not normal, but it will become so familiar. Even if it's not super easy, it'll become very familiar, and so there will be a lot of confidence that you build up from that too, and that always makes it
mhm,
easier.
mhm,
So
mhm. I
anyway,
think
that
that's
I
a
wanted
good
to add that
point.
one on.
Yeah, that's a good point. We've talked some about the community, the other parents. What are things that you would want providers to know and or what are some of the other things that the parents that are in the rare life community have talked about that they want providers to know about rare disease or what it's like parenting a medically complex child?
I mean, I think it would really just be kind of what I talked about earlier about my realization of the importance of my role in my son's medical care, of just like, oh, like, as a provider, you are such an expert on whatever topic you are an expert on, but that the parent is just as much an expert on their specific child. And I think just that acknowledgement is really important, and we can tell the providers that feel that, the ones that really value our input and want to know what we're seeing at home and, what's their baseline like at home and really value the expertise that we've worked very hard to gain over the years. And, it really is a very, very useful and vital part of our children's care. And so I think that when you acknowledge that and you understand that, and you also understand and acknowledge the limitations of your own expertise, right? Where it's just like, I'm a surgeon. I haven't recovered with a child at home from this surgery before. I don't know what the recovery is like. I think hearing stuff like that is really, really reassuring, and it helps us like gain this really powerful trust that allows us to work together on behalf of this child in a way that we couldn't if it's kind of head to head and a little bit of like power struggle and like who's really in charge. And um I'll also say that I think parents often, okay, wait, I don't wanna say often, but there can definitely be some trauma that is triggered by even being in hospital
Mm,
settings and being in medical settings from past, experiences with their child. And so I'll also say, I think sometimes just to keep that in mind, just give a little bit of grace because um, there are some real, I mean, even just the smells and the sights and, like, walking into the hospital can feel so like, "Oh my gosh, here we go again. There's so much pressure on me to do this and do it well by my child." And so I think if you find a parent really difficult to work with, I think just giving them the grace of, like, this is probably really emotional for them, and they're really scared right now,
right.
and they're probably exhausted, and not a way to, like, patronize the parent, but just to be like, to maybe not take things personally if they feel really hard to work with, and just to, understand that they're doing their best and they probably are doing it on not enough sleep and not enough energy and not enough resources and all the things. I think that can go a long way, and we really do appreciate the providers that, show that they really do care, and, it goes a long way in building that trust and that team.
Mhm, mhm. And I think too, it's like working with some physicians and other practitioners where they're always in the hospital, they're always at the doctor, so it's their comfort place, right? And I think you said it very well about having that grace to understand that that's not the world for this person that's coming in to see you. They also have things that are going on, just like you do outside in their lives that are impacting what's going on at the appointment today. Um, and I do think it's helpful to remember, like, you have a parent who's coming in because they wanna do right by their child. Like you mentioned, I'm here to do right by my son and to do what I need to do for him.
Yeah. Yeah. And I'll say too, because I don't wanna come across as like, "You darn providers, listen to us parents." I don't wanna, like, sound like that at all. We've worked with some really, really great providers, and the feeling of knowing that my child would not for certain would not be here without the providers that we've had in his life is very humbling, and it's overwhelming, and I don't like to think about what would have happened without providers because he wouldn't have lasted a minute after he was born, and so, the deep, deep gratitude that we feel, I don't know that it's always felt in a medical setting because there might be this, like, do or die, I need to advocate for my child right now feeling, but, I think a lot of us do acknowledge that and feel that. At least I do.
Mhm.
I feel
Yeah.
that deep gratitude for that and for people
Yeah.
who are willing to go into these professions.
Well, and I think it's all the feelings, right? It doesn't have to be just one or the other. It's kind of all this, like, multitude, of feeling, of emotion, and that really actually leads me into my next question, which is, you're a parent, you have things that you're working with Kimball. I think it's awesome that he's in a period right now, where he's stable and you feel like it's not as much as you were dealing with, shortly after birth and even probably a few years ago, but you're running a nonprofit, you're doing a podcast, you're also a wife, you're also a friend, you're also a family member, you have a sister, How are you doing all of these things without, well, that's assumptive, with managing some of that emotional energy and burnout?
Yeah, well, I made a huge adjustment, organizationally, for work, about 6 months ago where, my producer and she's also a parent that has experience with her own daughter having a rare disease, which was very key for this. We didn't swap, but she kind of took on a lot of the hosting because I was feeling myself over, the years of doing this, just becoming really burnt out with the heaviness of these topics because we kind of pride ourselves in going like face first into these really, really difficult topics. And so, I mean, it's like, some many of them at least touch on, if not directly talk about child loss and anticipatory grief and things like that that are just so harrowing. And I love this community so much. And so I think being entrenched in how hard things are, it really, really was weighing on me. I think at first I was better at kind of like, looking at it logically and more intellectually empathizing, but not getting too emotional with it. And I think it's just weighing on me heavier and heavier. And so we were able to make that adjustment. And so that has been such a big deal. And I've been able to work on more of the growth and the, legal status and, fundraising and stuff of the rare. Like that has been very needed. And is able to sustain the work that we're doing. And then my producer and now co-host has been taking on a lot of the episodes. I'll still come on, but it feels a little more surface because she does all the research and collects answers from the community and things like that for episodes. And so that was a huge one. It was affecting my personal life in a really real way because I'd be down and out for a couple days after recording an episode that was really heavy. And
Yeah.
so that has been something that I've really prioritized and been fortunate enough to be able to prioritize. Um, and then I'm able to give more to my kids and really enjoy them. Like I mentioned, we wanted more children. And I think once we realized we couldn't have them, we just really threw all of the love and attention that we might have had for 4 children into these 2 children. And so that's been a huge thing. And I've really enjoyed that. But I would say as far as, not like try to protect from burnout and things like that. I have always had this innate lack of guilt over self care. And so I feel no shame going off to the gym, doing a nice
Mhm.
Zumba class or lifting weights or taking a hot bath or reading a book or watching a show after the kids go to bed. So I would say that, like, I don't know. I guess I have some privilege in that and not feeling this guilt or shame that I know a lot of, especially moms, struggle with.
Mhm.
Because I just recognize that I'm a person just as much as my kids and my husband are people, and so why would I have to live a life, free of those things that make me happy and sustain me when they get to have those things? So, Um, those can become more sparse depending on your situation, and I definitely had fewer of those opportunities when Kimball was little, but I held on for dear life to my Zumba classes that happened twice a week. If I didn't get to go to those, I was full meltdown. So we made sure I was going to those, and so I think knowing that you have to be sustained can help justify the time that it takes to do those things.
Yeah, and I think like you said, like, just doing, not the bare minimum, but just really kind of laser focused, you can't do all the things, so if the Zumba's the one thing
Mhm.
that you can hold on to that. So you may not be able to do the 5 things, but if there's that one thing that helps sustain you or renews your energy, hang on to figure out how that could work.
Yeah, and even just makes you feel like, that was one thing that was really important to me. That was an identity aspect I had from high school. So just being able to keep doing that and keep that one sense of normalcy was so important.
Mhm, mhm. And you mentioned kind of changes and things that are happening with the podcast. What are you seeing in terms of, like, the nonprofit? Like, what do you think the next 5, 10 years look like in terms of building out that nonprofit or working with this community?
I think it's really just scaling it to get it to more people because, with podcasting, I mean, whether you could record this episode and one person listens to it or 100,000 listens to it, but that doesn't increase any of the work that you just did to make the episode. And so I think finding ways to find parents earlier in their experience with their children is something that we're prioritizing. So, for example, right now we're working with our board of directors on putting together this NICU survival guide that we're going to print and send to, I think it's about 10 different hospital NICUs
Mhm.
to be distributed. And in there, it has information of finding the rare life so that parents there, when they're ready, can go listen to these episodes and have a little bit of a window into what the rest of their life might look like. 'Cause that's one thing that is a huge mystery when you're in the NICU of like, what's after this? Like, what is my life going to be? And where's that community? And so just getting that to them as soon as possible. The NICU it feels like a really good place to find those families that need it. And so just looking at places like that, to expand it, and then we're also working on releasing kind of a tangential podcast, called Life After the Rare Life to be a place for parents who lose their children. Unfortunately, that's a huge that it happens all the time. Every week we find out about people who are in our community whose child passed away from their rare disease or complications, and so watching them kinda go out into the abyss and be like, "I don't" this has been such a huge part of their support while their
Right,
child was alive, and then not having that after they pass away and not being able to relate to child loss communities in the same way because it's such a unique situation.
right.
Um, I felt very, very drawn to creating a similar thing, but for after, and so there's kind of that safe landing spot for them,
Mhm.
hosted by someone who's lost a child. So we're working on finding a host for that and kind of just following the same, prototype that we've created for this and just transferring that over into losing a child from a rare disease. So I'm excited for that too.
Yeah, and I imagine too, like you said, that's probably a much needed community because it's one that doesn't quite fit in some of the ones that already exist and has
Yeah.
their own unique things that they need and that they're gonna wanna talk about.
Yeah, yeah, and it can be difficult to go back and listen. I just went to a funeral for one of our listeners' daughters, and she was like, "I need to stay part of this community, but I'm not sure how because now that I've lost my daughter, it's so painful to listen." And
Yeah.
so that was part of the reason I was like, we need to create something for that." And so it feels really important.
Yeah. Oh, yeah. Yeah, and I'm glad to hear that's, on the horizon and that you're continuing the Rare Life podcast because I think it's a huge resource. I think it's one too that is good, especially for either, like, new parents, parents that are dealing with a lot because podcasting does allow it to be somewhat passive in a way. You can
Mhm.
listen in your car, you can listen to it while you are in the NICU or while you're going to and from doctor's appointments or things like that. And you can listen for chunks kind of at a time. So I'm just glad that this continues to be a resource, and I would hope that any of the providers that listen to this show know that they can share that with their patients and that it is a valuable resource that they can share with patients.
Yeah. In fact, that is somewhere we're trying to in fact, that was one of the reasons that I'm here today is to try to reach genetic counselors because that also would be a wonderful setting to learn about something like this when you're reeling in all the information and looking for more of the emotional side of it and the emotional community support, I think can be so helpful. So, yes, shout out for anyone who, and I know that we do have providers that share their Rare Life as a resource for families that they work with, and we're so, so grateful because, it's how a lot of people have found us. So, yeah.
Well, like I said, we'll definitely put it in the show notes. We'll probably put some things up too on the social media. But Madeline, I just really appreciate you taking the time to share your story, to all of it, the nitty and the gritty, and you know, and for all the work that you're doing.
Thank you so much. This has been such an honor. I've really enjoyed it.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening, and join us next time.